There are growing concerns about hospital capacity and equipment shortages. Health reporter Stephanie Stahl is in another part of our studio with more on the situation for some Pennsylvania hospitals. Stephanie?
Well, Yuki, the Pennsylvania Health Department is in the process of setting up big screening sites, and that couldn't come fast enough for hospitals who have been doing testing and taking care of a surge of patients while struggling with shortages of protective gear.
We're very concerned about the safety of the patients that we have and our employees.
Jack Lynch, the president of Mainline Health, echoes the concerns of hospitals around the region as they're bombarded with patients. Many have resorted to drive-up testing to reduce the spread of COVID-19. They say a mass screening site like what happened in New Rochelle, New York, would be a big help. Two are being considered, one in Montgomery County, the other in Philadelphia, at the sports complex site in South Philadelphia.
I need to save my personnel and my supplies and my tests for patients that end up in my emergency room.
Lynch says they have 40 patients hospitalized at Lankenau, Bryn Mawr, and Paoli with positive and presumed positive cases of COVID-19. They're being cared for in specialized rooms to protect staff and other patients, but there are limited supplies of protective equipment, especially masks.
We're trying to not use the highest level on every single potential risk to ensure that we have those masks available for the more serious and higher risk procedures and patients.
As more hospital workers are now testing positive, whether they're exposed inside the hospital or the community, it could result in staffing shortages along with the medical supplies. To get through the outbreak, it's estimated medical workers will need 3.5 billion N95 medical masks. Currently, there is a national stockpile of only 12 million. Depending on the severity of the outbreak, 200,000 to 2.9 million intensive care beds could be needed. Right now, there are fewer than 65,000. Now, currently, Philadelphia area hospitals say they're doing okay with space and staffing, but that could change if there is a sudden surge in the number of patients with serious complications. And again, most people with COVID-19 have mild symptoms and recover safely at home. Jessica?
All right, Stephanie, thank you.